Good morning, everyone. Doc Dave here. Episode number 35 on that dreaded shingles. Yes, this is something you want to try to avoid at all cost. And in elderly people over 65, there's actually a shingles vaccination. But if you're under 65, you generally don't get the vaccination. And if you get the disease, you just kind of have to tolerate it for a few weeks till it clears up. But what is shingles? Shingles is also called herpes zoster. And it's a viral infection. It's a reactivation of the chickenpox virus, which is called the varicella zoster virus. And it causes a painful rash, which is localized to one side of the body. So if it's on the face, it doesn't cross the forehead. If it's on the chest, it doesn't cross the spinal canal area, your main spine in your back. It could be on your legs. It's going to be unilateral as well as on your arms. So that's the characteristic presentation. It's a blistery rash that is localized to only one side of the body. So if you got a rash on both sides, you don't have shingles. So what is it precipitated by? Well, it's precipitated mostly by a weakened immune system, secondary to a number of factors. Aging, that's why after 65 you get your shingles vaccination. Any illnesses that cause the immune system to be overwhelmed will reactivate the virus. Stress, very common. I mean, everybody kind of knows that stress is associated with outbreaks of cold sores on your lips, which is the same virus as the shingles virus. So major stress can precipitate the shingles virus and activate it by decreasing the immune system with stress. Cancers obviously decrease the immune system. HIV, same thing. And bone marrow transplants where you're put on chemotherapy and steroids to suppress the immune system so you don't reject the transplants. This can reactivate the shingles virus as well. Crohn's disease, which is a disease of the bowels, will activate it. Rheumatoid arthritis, and certain medications, like I mentioned earlier, steroids, immunosuppressants, chemotherapy, secondary to transplant surgery. So the most common ones, obviously, are your stress, aging, and your illness. Now, a common question that everybody wants to know, is shingles contagious? Well, as a rule, no. But you have to take certain precautions. And if the shingles are opening up and the blebs are opening up and they're discharging a fluid, then yes, that fluid has an active virus in it. So you shouldn't really be coming in contact with that. You should put a dressing on it and make sure you change the sheets. And basically, if they're really oozing out of the rash, you should basically try to stay away from it, use gloves, have precautions. But as a rule, if the rash is just a common rash and it's a dry rash and it's not oozing, you're generally not going to get any contamination from that. Things you should avoid when you have the shingles. Well, it's, processed foods, high sugar foods, fats in your foods, alcohol. It depresses the immune system to a certain degree, so avoid alcohol. Hot showers, avoid that because it dilates up the skin and the vessels can rupture. So those are some of the things you should kind of try to stay away from. So how do you diagnose it? Well, like I mentioned earlier, it's a single dermatome. We call them dermatomes in the medical field. It's a band of a blister that does not cross the midline. And the worst part of the shingles episode is usually day 3 to 5. Once you get past the first week, it kind of has a tendency to slowly decrease, and eventually resolve. So how do you treat shingles? Well, a lot of it is just conservative topical over-the-counter stuff like you want to put some type of an ointment on it. There's antiviral ointments. There's hydrocortisone 10 ointments. There's calamine ointments that keeps it dry so it doesn't rupture. Those are kind of the over-the-counter things you can do. The topical lidocaine with a 5% lidocaine in it is good for easing the pain. Non-steroidals, which are anti-inflammatories, like your Motrins, ibuprofens, Advils, Aleve. The main thing, though, is if you catch it early enough, if the rash develops and you know what to look for, or somebody around you knows what to look for, or you go to your doctors, if you can diagnose it within 3 days, 72 hours, you can take acyclovir, which is an antiviral medication. You got to take like 5 pills a day, and it's high dose, 800 milligrams. You got to do it for a week. So you're taking medicine almost all throughout the entire day, like every 3 or 4 hours you're taking another pill. But it does shorten the lifespan of the shingles and helps it resolve much faster. And in the long run, it'll make the disease much more tolerable. The other thing is you catch it early enough, again, within 72 hours, you can get a steroid shot, Kenalog or something like that. Their doctor would have to administer that to you. And that will help prevent something called post-herpetic neuralgia, which means once the rash clears, you still have a real sensitivity and pain in the nerve, even though the rash is gone. That's something you don't want. You see the rash clearing up, you're thinking the disease is clearing up, and then after the rash is gone, you get this pain in the nerve still. So the acyclovir and the cortisone steroid shots will be helpful. Otherwise, if you delay treatment, you're past 4 or 5 days, and you just, finally figure out what you've got, then you're just going to have to stick with the over-counter ointments and anti-inflammatories and stuff like that. Now, another question is, can you get shingles again? Well, yeah, technically you can get it a second time. It's not very common. Once you have it, you don't generally get it again. You almost never get it a third time. So it's kind of a one-time shot. And like I say, if you're 65 or over, another preventative treatment is getting the Varivax vaccination, and that will prevent the shingles from developing when you're an older age. So there you go. That's sort of a concise discussion on shingles. It's something that you should be aware of, and it's information you can pass along to others so that they're aware of it as well. And that should take care of the knowledge that you need to know about shingles. So if you like this, hit the like button, hit the share button, hit the subscribe button. I'll be back soon with another enticing episode on my podcast, so stay tuned, and you'll learn a lot from these episodes. So again, remember, I am your friend, not your doctor. Always consult your doctor if you have any questions regarding any particular episodes or diseases I give podcasts on for further information. So thank you for your time, and I will be back again shortly.